Did you realize that before this video ends, nearly 20 older adults will be told they have dementia? That's one new diagnosis every 66 seconds. But here's the part that should truly shake you. What if aging itself isn't the real trigger? What if the real cause is already sitting quietly inside your medicine cabinet? You've been told these pills are normal, safe, routine, even essential, yet new scientific findings are setting off serious alarms. Almost every senior alive has no clue that at least one medication they swallow daily may be shrinking vital memory centers in the brain by over 28% in under a year. Pause for a second and absorb that. I know this is unsettling. I'm Dr. Michael Kent, and I need you to hear this clearly. I've watched this unfold again and again in real patients. People trust their prescriptions without question. They believe that if it came from a doctor, it must be safe. All the while, the pharmaceutical industry has been aware of these damaging effects for decades, and still, they generate billions selling the very drugs that may be speeding up cognitive decline in millions of seniors nationwide. A major 2023 paper published in Neurology and Aging Research revealed that a specific category of medications raised dementia risk by 49% in older adults after just 2 years of regular use. That's not minor. That's almost double the danger. In this video, I'm going to expose the 9 most dangerous medications linked to fast-moving memory loss and dementia, ranked from quietly ignored to absolutely brain-destroying. And number 3 on this list is prescribed to millions for something that seems completely harmless, yet it can visibly shrink memory centers in your brain without you ever noticing it's happening. Before we go any further, I want your voice involved. In the comments below, tell us what medications you take every day. And have you noticed sudden brain fog or strange forgetfulness after starting a new prescription? We read every single comment and respond with insights tailored to real situations. Don't stay quiet. Speaking up right now could literally protect your mind. Now let's begin, starting with number 9. And don't underestimate it just because it's low on the list. This drug is sitting in medicine cabinets everywhere. It could be scrambling your brain long before symptoms appear. Number 9 is diphenhydramine, widely known as Benadryl. Diphenhydramine is that familiar pink tablet trusted by millions for sleep, allergies, or cold relief. It's cheap, sold without a prescription, and there's a good chance you have it in your home right now. You may think it's just helping you sleep or easing allergies, but inside your brain it's actively interfering with the hippocampus, the area responsible for creating and storing memories. Benadryl belongs to a group of drugs called anticholinergics. These medications block acetylcholine, a neurotransmitter your brain relies on to form memories and stay alert. As we age, our brains depend even more on acetylcholine. When drugs interfere with it, the consequences can be severe. A 2023 study in the Journal of Geriatric Cognitive Health found that seniors who regularly used anticholinergic medications had a 54% higher dementia risk than those who avoided them. That's an enormous increase for something most people see as harmless. To protect your memory, avoid products containing diphenhydramine, especially those labeled PM, nighttime, or allergy relief. Many are simply Benadryl under another name. If allergies are the issue, newer non-sedating options like loratadine, sold as Claritin, are far safer because they don't cross into the brain. Never stop a medication suddenly without guidance, but never assume over-the-counter means safe for your mind. Next is a drug group often advertised as gentle and harmless for digestion, yet it quietly robs your brain of what it needs most. Number 8 is proton pump inhibitors, especially Prilosec and Nexium. These medications reduce stomach acid and are commonly prescribed for heartburn, GERD, and reflux. Many seniors stay on them for years because symptoms return the moment they stop. What's rarely explained is that PPIs severely reduce absorption of vitamin B12, a nutrient essential for protecting brain cells and maintaining memory, focus, and mood. A landmark 2016 study in JAMA Neurology followed over 73,000 adults aged 75 and older. Regular PPI users showed a 44% higher dementia risk than non-users. By suppressing acid too strongly, these drugs also impair absorption of magnesium and calcium, minerals vital for nerve signaling. Without them, neurons misfire, leading to confusion and memory lapses that closely resemble early Alzheimer's. It gets worse. PPIs have been shown to increase amyloid beta plaque accumulation in the brain, a core feature of Alzheimer's disease. The good news is there are safer alternatives. H2 blockers like famotidine, sold as Pepcid, interfere far less with cognition. Natural options such as deglycyrrhizated licorice can also soothe the stomach without harming the brain. Next is a medication often prescribed for bladder control that may be quietly destroying memory and emotional stability. Number 7 is bladder control drugs, particularly oxybutynin. Oxybutynin, sold as Ditropen, is commonly given for overactive bladder and incontinence. While it seems practical, it works by blocking acetylcholine, the same critical brain chemical affected by Benadryl. Unlike milder drugs, oxybutynin easily crosses into the brain and directly impacts the hippocampus. A 2019 British Medical Journal study showed that adults over 65 using strong anticholinergics like oxybutynin for more than a year had a 49% higher dementia risk. Many seniors are never warned. They're told it helps bladder control, not that it may accelerate cognitive decline. Symptoms like mental fog, lost items, missed appointments, and trouble following conversations are often dismissed as aging, but they're frequently drug-induced. If you're taking oxybutynin and noticing mental changes, safer alternatives exist. Newer medications like mirabegron, sold as Myrbetriq, control bladder symptoms without blocking acetylcholine and are far safer for memory. Number 6 is statins. Statins are among the most prescribed drugs worldwide. They lower cholesterol to reduce heart attack and stroke risk. Simvastatin and atorvastatin, known as Zocor and Lipitor, are especially common. But cholesterol isn't just about the heart. Your brain is nearly 60% fat, and cholesterol is essential for maintaining the myelin sheath that allows nerve signals to travel efficiently. A 2023 study in Frontiers in Aging Neuroscience found that seniors over 70 taking statins for more than 3 years had a 26% higher risk of mild cognitive impairment. High-dose users experienced even greater decline. Some patients reported sudden memory lapses, forgetting names, conversations, or familiar routes. Not all statins are equal. Pravastatin and rosuvastatin cross into the brain far less and carry lower cognitive risk. If you're experiencing mental fog while on statins, it's time to discuss dose adjustments or alternatives. Acting early can protect your brain long-term. Number 5 is benzodiazepines. This group includes lorazepam, diazepam, and alprazolam, commonly known as Ativan, Valium, and Xanax. They're widely prescribed for anxiety and sleep. They work by enhancing GABA, the brain's calming chemical. Initially, they feel helpful, but over time, they become a trap. A 2022 British Medical Journal study tracking over 8,000 seniors found that benzodiazepine used longer than 3 months raised Alzheimer's risk by 51%. Long-acting versions like diazepam are especially dangerous because they accumulate in brain tissue. These drugs slow neural activity, reduce learning capacity, and cause persistent brain fog. Many seniors feel disconnected and emotionally numb. Withdrawal is brutal, making the drug seem necessary when it's often the root problem. Never stop suddenly. Work with a doctor to taper slowly. Safer options like buspirone or cognitive behavioral therapy for anxiety and insomnia can restore calm without damaging memory. Number 4 is amitriptyline, sold as Elavil. This older antidepressant is still prescribed for pain, sleep, and migraines. It's also one of the strongest anticholinergic drugs still in use. Long-term use almost guarantees cognitive side effects. A 2015 JAMA internal medicine study of adults over 65 found that high cumulative anticholinergic exposure increased dementia risk by 54%. Even low nightly doses over years can silently erode brain function. Memory loss, word-finding issues, and concentration problems creep in unnoticed. Safer alternatives exist: duloxetine or gabapentin for nerve pain, melatonin or low-dose doxepin for sleep, and newer antidepressants like sertraline or escitalopram for mood are far gentler on the brain. Number 3 is paroxetine, known as Paxil. Paroxetine is a common SSRI for depression and anxiety, but it's the only SSRI with strong anticholinergic effects, making it fundamentally different from others like sertraline or escitalopram. A 2021 review in Frontiers in Psychiatry showed that older adults on paroxetine experienced declines in memory, attention, and verbal recall within 12 months. They were 30% more likely to show early cognitive impairment than seniors on other antidepressants. Paroxetine is listed on the American Geriatric Society Beers criteria as inappropriate for older adults. Seniors should avoid it entirely. Safer alternatives exist, and B vitamin support may reduce medication needs over time. Number 2 is antipsychotics. This is especially disturbing because many seniors don't know they're taking one. Drugs like quetiapine, risperidone, and olanzapine were created for severe psychiatric illness, but are now often used off-label for sleep or agitation in older adults. A 2022 Lancet Healthy Longevity study followed over 25,000 seniors and found a 71% increase in rapid cognitive decline within a year of antipsychotic use. These drugs also raise stroke and sudden death risk. They suppress dopamine, a chemical essential for motivation, executive function, and memory. Seniors often appear emotionally flat, disconnected, and zombified. Families must ask why these drugs are prescribed. In many cases, non-drug approaches like structured routines, pain management, better lighting, and sleep hygiene are far safer and effective. Number 1 is anticholinergic polypharmacy. This is the most dangerous situation of all. It's not one pill, it's the combined effect of multiple anticholinergic drugs taken together. A senior taking diphenhydramine for sleep, oxybutynin for bladder control, and amitriptyline for pain may experience exponential brain damage. A 2022 study in Age and Aging found that seniors with the highest anticholinergic burden had a 120% higher dementia risk within 10 years. Most had no idea they were taking anticholinergic drugs at all. When acetylcholine is blocked from multiple directions, neurons shrink, synapses disappear, and the brain enters a state that mimics Alzheimer's. The solution is a full medication review. Identify anticholinergic load, deprescribe slowly, and replace with safer options. Drug-induced dementia is often reversible when caught early. The brain can recover once the burden is removed. Now, I want to hear from you. Which of these medications are you taking? Have you noticed brain fog or personality changes? Will you talk to your doctor this week about reviewing your medications? Share your story below. It could save someone else's mind. Thanks for watching. I'm here to help you stay sharp, healthy, and strong for years to come.